Hello and welcome everyone to the next audio podcast on this series on the LabZtorm critique. This is another ZtormLabostix production in collaboration with the Renal Patient Support Group, the RPSG, and this is on the audio podcast series on the LabZtorm effect v.2. And today I'm going to be giving an overview around this collaborative peer review publication relating to a topic that is similar to what's been discussed before relating to hemolytic uremic syndrome, or HUS. But today I'm going to be giving an overview by reading the abstract around this peer review publication on Henoch Schonlein Purpura, HSP, and what can we learn from biomedical and clinical anatomy practice on this multidisciplinary disease. And this work again was published in a peer review publication in 2018. And I'm going to give a bit of a breakdown around this topic, relating the background, some epidemiology, the aims, the practice around this, the research stance on this, some discussion and conclusion. So here goes. So Henoch Schonlein Purpura, or HSP, is one of the most common vasculitis conditions in children or pediatrics or young people, and it's characterized by a triad of symptoms. Number one, palpable purpura without thrombocytopenia. Number two, abdominal pain, and three, arthritis. Now, renal involvement also often occurs in children with HSP, and Henoch Schonlein Purpura is also the most common vasculitis condition in occurring in between 8 to 20.4 per 100,000 children per year. Now, when I say children or young people, basically it's almost like a bit of a cutoff, because basically where nephrologists, practicing nephrologists, have said that some patients who fall into the category of HSP or Henoch Schonlein Purpura look like HUS. Some actually look, who have HSP, look like HUS, and vice versa, and so on and so forth. So the condition, or where HSP is concerned, in this peer review publication, there is literature that substantiates that actually it can be it's a bit of a fine line, because when children, as far as children and young people are concerned, they can be diagnosed with HSP. So for HUS, for example, children or young people are diagnosed much earlier. So actually, in what's probably referred to as or can be substantiated as the actual pediatric years. So anything from ages 0 or neonate, or naught, sorry, not neonate, something in the region of say 5 to 10 years old, in some contexts. And then in HSP, it's those who are it's still obviously pediatrics, but more adolescents. So when it's adolescents as well, it's also referred to as almost young adults in some regards, because the years that they are diagnosed with this condition is any age from, say, for example, 11, 12, or 13 years old, up until they are younger adults, as in up until the age of for example 14, sorry, between 13 and 18, for example. Obviously, where HSP is concerned, it's picked up much earlier, because the condition has, again, much like HUS, has a triad of symptomology. So in this context, it is one of those conditions that is also pronounced as a hematological sort of has an underlying hematological basis. Now, from an epidemiological perspective, HSP usually occurs in children or young or in adolescents between 2 to 10 years old, but can be older. With 50% of all cases occurred in most cases. In most cases, children can be diagnosed. Children or young people can be diagnosed younger than 5 years old, but mostly in children aged 4 to 6 years old. The condition, the symptomology gets worse in adolescence, in the adolescent years, so, as highlighted, and then in adult years, where things like, where, for example, one of the symptoms, as mentioned, is arthritis, which most who would refer to this peer review publication or any other publication that looks at arthritis and think, well, in young people that can't be, that doesn't make sense. Actually, it is in this condition, in this particular condition, it's one of the sort of the symptomologies that causes the sort of devastation around around the health condition, as part of the health condition, because what happens is in children or young people who have HSP or diagnosed, what happens is their joints become before the joints are vulnerable. What happens is there can be bruising, and that bruising is owing to the the vasculature that relates to the arteries and the veins that link to major organs. Basically, what happens is that there can be thinning, and then what happens on the skin or the surface of individuals, what looks like that thinning, or that thinning when it's pronounced or it's obvious, what happens is on the skin it can actually look like look like bruising, and that bruising is referred to as petechiae, which is basically where it's like bruising, like say someone almost like as like, for example, someone gets for example hit somewhere and there's bruising. The bruising can look as dark as that as well. So in young people and adolescents who are diagnosed with HSP, what happens is that there is this triad of symptoms, and then it can cause sorry, but before getting into more of the causes, there is a predominance that's frequent, that's more frequent in male versus female gender, and although it is generally a self-limiting condition, HSP can cause renal or kidney manifestations with various incidences. The guidelines and treatment for managing care in HSP patients ranges between nephrology practices and nephrology centers globally, generally speaking. So the aims of this work, this peer review publication, was to provide a practical understanding of HSP and as the main aim, and then to highlight the importance of multidisciplinary laboratory practice for patients with HSP, and then the third entity was to highlight what laboratory practices could be enhanced to support the development of HSP guidelines. Now, the practice around this condition is multi-specialty disease, wherein a patient's care plan will have laboratory focused from the very beginning. Much like HUS in that context, hemolytic uremic syndrome, from a variety of pathology departments or blood sciences. Laboratory investigations suggest that HSP is not a self-limited disease, and patients eventually develop chronic kidney disease, unfortunately. Now, as I mentioned with HUS, what happens is there's low platelet count. So actually, when someone bleeds or someone is bleeding with HUS or with HUS or with HSP, what happens is that with thrombocytopenia, there's a low platelet count. So that means basically when they bleed, unfortunately, their bleeding time is a little bit longer than the usual time it takes to clot. So when it comes to hematology, what happens is they have a pronounced clotting time when looking at the investigation in context from under hematological parameters. And along with this, obviously, from a laboratory perspective, abdominal pain cannot be identified or cannot be identified, but the clinicians, what they would do, or the frontline professionals, what they would say as part of the request to understand what's going on in a patient, they would actually say that as part of the request that the patient has symptoms of abdominal pain, and would say some mild to moderate joint pain, or there is bruising, for example. And that gives the laboratory specialists an idea of basically that it could be HSP potentially. So anyway, moving on. Apart from being a multi-specialty disease and laboratory focused condition, laboratory investigations suggest that HSP is not self-limited disease, and patients do eventually develop a chronic kidney disease. From a research stance, in a retrospective study of 141 patients with HSP, again there was some literature in 2015 by one team that highlight that abdominal pain was not always related to HSP nephritis. However, in 45% of the patients, there were complications with other health comorbidities, and nearly 30% of them had a long sort of symptomology in line with the disease. So so apart from having chronic kidney disease, which is part of the trajectory of HSP, what happens is that the patients will also have other potential health issues that are also pronounced. And multidisciplinary laboratory perspectives are paramount in disease follow-up and to help inform clinical decision making. Now, future biomedical laboratory practice can help bring about more informed clinical decision making in the care of young people or adolescents who are diagnosed with HSP. More case and longitudinal studies would be helpful to understand whether patients would benefit from different care plan options. And in more recent work that's come out in literature, there are sort of guidelines that relate to that, and then evidence from an overall perspective on this peer-reviewed publication was that evidence informs that male gender aged greater than 10 years have symptoms of severe gastrointestinal involvement, arthritis and arthalgia, So the question that is asked in here, so what can we learn from this multidisciplinary disease? Certainly well-designed and conventionally reported studies in histology, microbiology, and hematology laboratory collaborations are still important, and they're still important across blood sciences to identify HSP disease development and progression. And if anyone is interested in following up or looking into this work, there are keywords that you can, the main words that you can check out in your search engines to an extent. And if you're to a certain extent, search engines recommended would be, for example, PubMed or EBSCO host search engines, for example. To follow up on works related to Henoch Schonlein Purpura is actually put in main words: Henoch Schonlein Purpura, or hematology, microbiology, or renal. Any of those sort of words in different orders would give you hopefully an overview of different sort of peer review publications in those search engines. I mentioned those search engines just because with putting these words in just in like a Google search, that can be problematic and can lead to misinformation. So once again, I want you to thank those for listening to this particular audio podcast around this particular sort of this disease, this health concern around nephrology, Henoch Schonlein Purpura, and what we can learn from biomedical and clinical anatomy practice on this multidisciplinary disease. This has been another ZtormLabostix production in collaboration with the Renal Patient Support Group. This is the series on the LabZtorm effect v.2, and it's all about the LabZtorm critique. Thank you for listening, and hopefully we'll catch up on the next one. Thank you.